I think some of you have probably heard John and I talking, and we're just going to start up here in just a couple minutes, but those that are already on, please just be patient with us when we're just giving others a few minutes to get on the call. Really looking forward to this. So. All right, this is Carolyn at DFC Consultants, and we have John Culver on as well. He is from Greenshades, and he will be presenting the ACA webinar, giving you guys a lot of information. So thank you all for attending. And John is going to go ahead and record this session, so if that's something you can't be part of now, it's probably a good time to drop off, and then let Jody or myself know that you did that, and we can arrange something different for you. He will be explaining how the Q&A can happen or when it will happen, and then also how the phones will be muted. So with that, John, I'm going to let you go ahead and take it from there.
All right, thank you very much, Carolyn. And like Carolyn said, this is John Culver with Greeshades Software. I'm going to be going over a couple different items from the Greeshades Software side and how we can help with the Affordable Care Act compliance tracking and reporting. So we do have two solutions that we're going to be taking a look at today. Before we jump into the products, though, I do want to talk a little bit about the structure of the meeting. So this is going to be, for the most part of the meeting, a listen only from the attendee standpoint. There is a hand-raising option within the GoToWebinar. So if you have a question at any point, if there's anything that you want me to stop and go back over or talk about a little more detail, or you just have a general question along the way, please feel free to click the raise hand option and type your question in, and we'll be able to then address that question. I'm also going to, at the end, open up all of the audio for any discussions or questions that anybody has lingering that maybe you didn't want to type into the question box or it may be too detailed. So what we're going to do first today is give a quick overview of the Affordable Care Act regulations and requirements from the employer's standpoint, and then we'll jump into the solutions here and talk about how the Greenshades products will be able to assist with those. So when we are talking about the Greenshades products, the first product that we're going to discuss is our Dynamics Payroll Inspector, and then we're going to spend a little bit of time going through the benefits enrollment module. Both of these have the key characteristics of tracking the compliance related to the Affordable Care Act from the employee standpoint. So we're talking about eligibility, minimum essential coverage, minimum value plans, and affordability. Both systems have those two aspects of compliance tracking built in. The benefits enrollment, however, goes a little bit further because it begins an interaction with the employee. So we can put some rules in place that would allow a benefit package to be available to specific employees based on a department or a class or location, pretty much any field from the employee maintenance window. What we have the ability to do, though, now with the new Affordable Care Act full-time status rule is have that be one of the drivers for a benefit package. So we can put a rule in place that would make an employee be full-time before they're eligible for one of these packages. So when an employee becomes a full-time status employee, they would be notified from the Greenshades system that they're now eligible for a benefit, and then they would be directed to our portal to enroll. So from the compliance tracking standpoint, the Payroll Inspector and the Benefits module will handle all of that throughout the year. The next step and the next piece of the puzzle when it comes to Affordable Care Act compliance tracking and reporting is the actual reporting piece. So our system is also going to help build the electronic version of that 1094-C, which is the form that needs to be submitted to the federal government starting next year. So I believe it's due at the very end of March, just like the W-2 report that you submit annually. The other piece is the employer or the employee form, so the 1095-C. And if any of you are currently using Greenshades, you're probably familiar with our electronic distribution of W-2 forms. So we open up a portal, put W-2 forms online, and allow employees to access them electronically. And if any employee doesn't get them electronically, you can use our print and mail service and have those paper copies sent directly to the employees. That same exact process is going to apply to the 1095-C. We'll post them online and then open up our print and mail service for the distribution of any forms that didn't get consented to an electronic copy. So that being said, what we'll talk about now is a brief overview of the Affordable Care Act regulations. And this would be a good time if you have any questions while we're going through these regulations, because I am going to discuss them at a high level to ask any questions. So the first thing that we need to track when it comes to Affordable Care Act is the employee eligibility. So the employee eligibility is going to refer to those three periods that I'm sure you're pretty familiar with or have at least heard at this point. It's the measurement period, the admin period, and the stability period. So there is a need for you to track, based on a certain number of months, how many average hours an employee has worked. And that number of months can range anywhere from 3 to 12. So that's going to be completely up to you. The next step is the administrative period. So that's the amount of time that we would allow for the actual enrollment process to be completed from the employee's standpoint. And then from there you have the stability period, which is the length of time that you need to offer an employee insurance once they've become eligible and once they've enrolled in that plan. So the next piece is, once we get out of the eligibility, is the tracking of the minimum essential coverage, the minimum value plan, and the affordability. So we have to make sure that we're offering employees not only correct insurance, but insurance that meets those guidelines. We then have to make sure that once we offer the employees the benefits that meet those guidelines, that it's falling into what we call an affordable range. And this is going to be based off that 9.5% of income that, again, is something that I'm sure you've heard or discussed at some point. So what our tools are going to do is map back to Dynamics GP to gather all of that information and make sure that you're staying in compliance when it comes to those regulations. As our system compiles all of that data throughout the year for the tracking of the compliance, we'll then be able to move that over to the report, being the 1094-C and the 1095-C. So if you can see, based on what we're doing with the compliance tracking, it leads to a natural progression to the creation of the 1094-C and the 1095-C with all of the data that we've populated throughout the year. So that being said, if there aren't any questions at this point, I'm going to get into the product showcase now. We'll start with the Dynamics Payroll Inspector and then move over to the Benefits Enrollment module. So I'll open it up for a couple minutes here and see if anybody has their hands raised and see if there are any questions about the ACA regulations that I can answer at this point. All right, so it doesn't look like we have any questions. So what I'll do is get into the Dynamics Payroll Inspector product. The Dynamics Payroll Inspector is a really unique tool. It is modular and it does do a couple other things outside of the Affordable Care Act, which is why you see these grayed out windows in here. So these are pieces that you can add on. The Dynamics Payroll Inspector is neat in the fact that it can be installed in a number of different fashions. So we can install this if you're running GP on a Citrix server. We can install the Payroll Inspector, so whoever has access to that server will also have access to the Payroll Inspector. We can also get this installed on users' desktops, which is the ideal fashion to have the Payroll Inspector installed because it provides active alerts. You may have seen a couple little triggers popping up down here that look similar to this as I've been talking. So the Payroll Inspector does live on a user's desktop if that's the install method, and it's going to allow alerts to be populated directly through the Windows toolbar. So this can be installed on an unlimited number of users' machines. It can be installed to look at an unlimited number of employees and an unlimited number of Dynamics GP databases. The first thing that we'll discuss with the Payroll Inspector is the eligibility piece. So what I want to show you is the settings for this tool and give you an idea of really how simple the Payroll Inspector is to use. The Payroll Inspector is a tool that once we outline some of the parameters that need to be outlined, there isn't much more we have to do. It's running in the background of our system and populating notifications as things change in the GP environment. So the implementation is very quick and painless. So what the first piece of the puzzle is to do when it comes to the eligibility is choose where you want us to store the full-time status. So back in Dynamics GP, there are a bunch of fields that are available for us to use. We can store in Payroll User-Defined 1 or 2 or any of these HR fields. We also have the ability to restrict the calculation for full-time employees based on class. What that means for you is if you have groups of employees that you know are automatically going to be full-time once they're hired, then we can exclude them from that variable hour calculation. So for example, if you have an hourly and a salary class, we can assume based on your setup that anybody who's associated with the salary class is automatically going to be given insurance after 30 days or whatever the reason that we can exclude them from that calculation. The next step here is to choose which pay codes we want to represent hours of service for employees. This gives us the ability to be flexible with how you're paying your employees and the types of earnings that your employees are receiving. So we've heard from a lot of clients that use piecework to pay their employees, whether it's a trucking company that's paying by the load or by the mile, or it's a home health company that's paying by the visit. The Affordable Care Act does require that you track employee hours worked, even if you're paying strictly on piecework. So what we can do is have a secondary pay code set up. It may have $0 associated with it, but it's designed to track hours only, even if the only part of an employee's payroll is being processed from that piecework. So what we can do here is restrict which of the pay codes are going to represent hours of service. Once we have those rules put in place, we then can create the measurement group. So a measurement group is going to outline the measurement, the admin, and the stability periods. And once we have this in place, the Payroll Inspector is set up, at least for the eligibility portion, and ready to run. So the first thing we're going to do is name the group. According to the Affordable Care Act, in an organization, you can have multiple measurement groups. So if you had a set of employees that you wanted to have a 3-month measurement period and another set that you wanted to have a 12-month measurement period, you can set that up. There are some restrictions on what would allow you to create multiple measurement groups, and that's going to be whether an employee is union or non-union, if you have employees in different work states, and also if you have separate EINs. So you may have multiple measurement groups, and we can accommodate that within the Payroll Inspector. The next step here is to outline your measurement period or your look back period. Those terms are used interchangeably. So what we do is choose, first of all, the length of our measurement period. It can be anywhere between 3 and 12 months. So we'll choose a 12-month measurement period. You're also going to choose the start date of the most recent measurement period. And then we're going to set the first day of the company work week. So with these 3 parameters in place, this is going to allow us to assess all individuals that are currently with the company and fall into the what we call company measurement period, which is based on the date. However, there's going to be employees that are added to your organization, and when they're added, they have their own unique initial measurement period based on their start date. So not only does the Payroll Inspector take a look at the employees that are currently in your environment and populate notifications if there's a change based on that company measurement period, we also are going to notify you once an employee completes an initial measurement period and give you their full-time status. So if we had, let's just call the measurement period Jan 1 to December 31st, and an employee comes in June, their measurement period is going to be from June to June. So once that employee completes that measurement period, there's no need for you to have to remember and complete the calculation. You'll receive a notification through the toolbar down here letting you know that you have employees that need to be inspected or fixed. And you'll then enter into the Payroll Inspector and complete that change. So once we have that period put in place, the next setting here is to put the admin and stability periods in place. Very simple. We'll choose the length of time. Do keep in mind that all the compliance for the Affordable Care Act is built into the Payroll Inspector. So if we have a 12-month measurement period, we can't have less than that for a stability period. If we choose a 3-month measurement period, you'll see that we now have more options for the length of that stability period. And again, these are all Affordable Care Act regulations built right into the system. This does also give us the ability to do some what-if calculations. So if we're still in the process of choosing a measurement period, as I choose and switch between measurement periods, this calculation table that you're seeing at the bottom of my screen will change. So if I go from a 3-month to a 12-month measurement period, we're going to get an adjustment of what those periods look like moving forward, so you can get an idea of how this is going to affect those measurement periods based on the timelines that you choose. Once we have that in place, the Payroll Inspector is ready to run. So I'm going to cancel that out. I'm going to close, go back to the home screen here, and we'll see the calculations beginning to take place. Once the calculations have been completed for the eligibility, we'll click Fix Now because we have eligibility reviews to take a look at. So when we click Fix Now, it's going to give us a full idea of the GP environment that we looked at. So it's letting us know that 521 employees had their eligibility inspected. 3 don't need a change, 47 are eligible, should be offered insurance, etc., etc. So when we click Next here, we're going to have a drop-down that allows us to take a look at those different subsets of employees that we saw on the last screen. So if I wanted to look at just employees with a change, I could. If I wanted to look at all inspected employees or employees just changed to full-time, I can manage that through this drop down. So what we'll do is we'll switch here, or we'll take a look at employees changed to full-time. And this is going to give us a breakdown of each employee. It's going to show us their hire date. It's going to show us their measurement period. And then it's going to give us the ability to send this information back into Dynamics GP. So we have 3 options for each employee. We can be reminded later, which means I run the Payroll Inspector at a later time, and I get this notification again. I can ignore this, or I can update Dynamics with suggestions. So when we were going through the setup, I showed you the screen where we can choose which field in GP we want to store that full-time determination. If I choose Update Dynamics with the suggestions and I click Finish, this is then going to push that full-time status determination back into Dynamics GP for Angela. So the Payroll Inspector's job is to keep you, the users of Dynamics GP, notified of any changes, and also keep you notified if there's a compliance issue that needs your attention. So as far as the Payroll Inspector is concerned, its job is done at this point. It's completed the calculations. It's looked at the employees' measurement, admin, and stability periods. It's populated the notification and then given you the ability to put that suggestion back into Dynamics GP in a field of your choosing. So as far as the eligibility is concerned, again, we've completed the process here. There isn't going to be any employee interaction, but this is going to keep you alerted and allow you to then start the enrollment process for that employee. So what we're going to do now is switch over to the second widget, which is the Affordable Care Act Health Insurance Coverage widget, which is going to inspect the minimum essential coverage, minimum value plan, and affordability. Before we do, though, I'll take a minute at this point and see if anybody has any questions on the eligibility piece. All right, so it doesn't look like we have any questions. We will move on. So what I'm going to do with the coverage widget is the same exact thing I did with the eligibility widget. I'm going to show you the setup screen, and then I'll show you how we will fix a problem that we found. So the actual setup for the eligibility is even easier than it is for, the setup for the coverage is even easier than it is for the eligibility, simply because what we're doing with this is mapping back to data that's already available for us. So we have the ability to run this tool with or without the human resources module set up. So one of the really neat things about the Payroll Inspector is that it was designed to work in an environment that was on an unsupported version of Dynamics GP for the Affordable Care Act. So we built this in mind with our users that were on GP 2010 or our users on GP 2013 or 2015 that don't have the HR module activated, because that's where all of those fields are located, in the HR module in 2013 and 2015. If you don't have 2013 or 2015, or you're not using the HR module on that version, there won't be a place in GP to store the data related to the Affordable Care Act. So what the Payroll Inspector does is give you the options to use it with the Human Resources module or without it. If you don't have the Human Resources module activated, we'll store all of the information for you. So this is a big relief to a lot of our users that don't have the HR module or aren't on 2013 or 2015, simply because this is going to give you another route for managing the Affordable Care Act compliance and storing that information in other places. So there's actually going to be Greenshades tables created in GP within the for the Affordable Care Act, whether you're using the Payroll Inspector or you're using our Benefits Enrollment module, which we'll get to in a few minutes. So what we have the ability to do here is ask you, which plans from Dynamics GP are meeting the minimum essential coverage guidelines? And you go through and you choose which one it is. You do the same thing at each coverage level. And then what we're going to do is look at the minimum value plans. So we'll go back and say, based on these options available to us in GP, which ones of these are meeting the minimum value plans. Once we have that in place, we are ready to complete the process of inspecting employees' affordability for healthcare. So again, we'll close this. We'll allow the Payroll Inspector to do the calculations. It's completed, and we'll click Fix Now. So right here at this point, we'll then give you a breakdown of the entire GP environment. So the first thing we're going to show you is that the minimum essential coverage is being met at 53.33%. So this is going to give us a quick view to say we are out of compliance, because one of the main components of being in compliance when it comes to tracking the health care is minimum essential coverage. We have to offer 95% of employees minimum essential coverage. So this is going to show us that we're only at 53.33%, and there are two components that make up that minimum essential coverage offer, and that's employees not being offered any coverage that are eligible, and employees' dependents not being offered coverage. The next piece here is going to relate to adequate coverage. So there are a couple components, again, of the adequate coverage. They're the minimum value plan offering and the affordable coverage. So we'll show you at a glance what number of employees aren't meeting the requirement for the adequate coverage, and then these two are going to be the breakdown of the two different components of adequate coverage. So just like on the eligibility widget, when we click Next, it's going to bring up a list of the employees that are meeting the requirements through this drop-down. So if we want to look at all employees, we can. All employees that have inadequate coverage or no coverage. And this will then give us a full details tab of exactly why we're out of compliance with this employee and what we can do to fix this. So when we click on the full details tab here for Brenda Diaz, you can see that this employee has no eligible offer. She's waived or not enrolled in every one of those because she isn't eligible. So if we had the benefit and deduction codes inside of Dynamics GP activated for any of these plans, we would then make her eligible for that minimum essential coverage. And as I click this button right here, you'll see all of the X's across the bottom switch to check marks, saying that we're in compliance. And this is based on an offer. So you can see that I have made my employee eligible. Even though she's waived, I'm still in compliance because I'm offering her a plan that's meeting the minimum essential coverage, minimum value plans, and affordability. So if I were to come in here and increase the employee portion cost of that benefit, you will see that I'm now not in compliance for the affordable minimum value offering, because what we're doing is we're applying the safe harbor rules for affordability and looking at this employee's income. So again, most of the information we need is already stored in Dynamics GP. This tool houses all of the information for the Affordable Care Act compliance. So we're going to look at the employee information already stored in GP, compare it to the rules that are available for the Affordable Care Act, and then make that determination of, is this plan affordable for this employee? So if we had an environment, and we were pulling this, again, directly from Dynamics GP, in this test environment, I have the ability, and you will in the live environment, to make these manual changes. But if we were to pull this exact situation out of GP where this employee's offered this coverage and it's this cost, we would have an explanation across the top saying, this employee is being charged $1,500 for this plan, when in reality they need to be charged $80. So if we were then to make the edit to the amount that that employee needs to pay, you can see we're still out of compliance for 1 month. Maybe if we go down to 70, there we'll be good then. So what we have the ability to do then is make a change to this cost. So what we can do then is push that cost difference back into Dynamics GP and update the benefit and deduction codes for this specific employee to make sure that we're in compliance. So again, the Dynamics Payroll Inspector is not only going to show you when you're out of compliance through the toolbar notifications down here, but it's also going to give you suggestions and recommendations on how to fix those mistakes that we see from the employee standpoint. The other nice thing about the Payroll Inspector is the fact that it allows us to store dependents. So again, just like with the Affordable Care Act tables, the dependent table isn't going to be available if the HR module isn't activated in Dynamics GP. So what we have the ability to do is allow you to store that dependent information in the Payroll Inspector. So we'll store first name, last name, relationship, social security number, and birth date. These are the components that are required to be reported on the 1095-C if you're required to report full dependent information. So what we can do in here is then choose, do we have this employee or this dependent covered on a plan? We can click yes, we can click no, and when we click save, it's going to update the last screen we were on with that new information. And then ultimately the entire purpose of this tracking widget is to generate the proper codes, those IRS codes on line 14 and line 16 of the 1095-C with the proper code. So when it comes time in January to create those reports, you'll be able to pull all the data that's been calculated for the entire year directly from the Payroll Inspector and create that 1095-C in an electronic format with all of the necessary information and post it to the employee so they can retrieve it electronically. So as far as the Payroll Inspector goes for the Affordable Care Act, that's a pretty good overview at this point. I would like it if anybody had any questions to type those in now. Raise the hand and we'll get those questions answered. We'll give it a minute. If no questions come up, we will switch over then to the web-based solution, which is our benefits enrollment module, and discuss that. All right, so it doesn't look like we have any questions. What I'm going to do now is close the Payroll Inspector. And now everybody should see my Chrome browser coming through. I'm on the Greenshades University sign-in page. This is going to be my test environment. I'm going to show you a brief overview of the employee side and then take a look at a couple of features on the admin side of the portal, just so you can have an idea of what both pieces look like. So I'm going to get signed in. It's my trusty test employee, Jennifer Bryant. And when I do, I'm going to click the Benefits tab across the top. So this is where the employee would be directed for any type of enrollment event. So this is going to include the open enrollments or the status changes, somebody going from one department to the other, or ACA full-time status to not full-time status and vice versa. This is also going to manage the qualifying life events and also all of the new hire enrollment. So when an employee has access to the benefits enrollment portal, they're going to see their current enrollment in the top left. Very straightforward, self-explanatory. If we had options up there, employees would be able to see the more details tab, which would give them information on the plans. They would also have access to the documents. So if you wanted to attach a PDF or some type of document to a plan that you wanted the employees to have access to, you can. Moving down, we have the pending elections. This is just going to show what the employee has completed for this enrollment cycle but hasn't yet been pushed into Dynamics GP. We have the eligible benefits. This is where our system gets really flexible because we use that rules-based system to determine eligibility in a plan. So at the end of the day, every single employee could have a plan that is different from somebody else's. And when I say plan, I'm referring to a benefit package, a group of benefits. So this is going to be specific to each employee looking. Again, we can pull up the More Details tab for any of the options that they're enrolled in and also view any documents that are associated with a plan. A nice thing to keep in mind with the benefits enrollment module is this also is going to handle all of the employee dependent information as well. So when we're using the benefits enrollment module, we'll also have this HR profile module activated, which is where the employees would have the ability to update the dependent information. So if I just had a kid and I needed to claim a qualifying life event and add my new child to my benefit, I would be able to go into the Dependents tab, add that dependent information, and as soon as the dependent information is added into the system, it'll be available for me to add as a dependent on a plan or as a beneficiary. So we'll go back to the Benefits tab. And we also have the Qualifying Life Event and the Open Enrollment tab. So this is where the employees would complete those enrollment events. So I'm just going to do a quick overview of this for you. Keep in mind that when an employee goes through the enrollment process, it's going to look the same, whether it's an open enrollment or a new hire or a status change or a qualifying life event. The employees are going to be shown the 4 major categories of benefits. These are pulled directly from GP, the health benefits, life and disability, other benefits, and we also have retirement. We don't have one in this test environment apparently. And the employee would simply go through and waive or enroll in each of the benefits. So this process for completing an enrollment and managing the Affordable Care Act is very organic because we have a little more control than we do with the Payroll Inspector, because the Payroll Inspectors were mapping back to benefit and deduction codes in GP. This is actually putting those plans online and tracking each enrollment and each waive for each employee. So when the employee goes through the enrollment process, they're going to be shown the 2 plans, 3 plans, 5 plans that are available to them. They'll choose one or the other. We can pull up more information at any point. So if we pull up more information, we can compare the 2 plans side by side. We can be shown the documents at this point in the enrollment process as well. And then we'll choose a coverage level. So at this point, if we chose employee only, we would finish this. Family coverage, we would finish this. And this is going to collect the eligible offer for employee-only minimum essential coverage, because it's very clear to see that even if we enrolled in the family coverage or another coverage level, that we were offered that employee-only coverage. So we would finish this up and then be sent back to the open enrollment screen where I could log out, come back in the next day, come back in the next week and enroll in my dental insurance or waive my short-term disability. Once I've completed it, I'd sign off on it electronically and submit. So very simple, very straightforward from the employee standpoint. I am going to take a minute, see if anybody has any questions on that before we switch over to the admin side. All right, let's get logged in then as an administrator. This is where all of the Affordable Care Act compliance related aspects are going to be managed. And there are just a few things over here that I want to show you, so we should be able to finish up in 10-15 minutes. So the first thing I want to show you is under the Settings tab for the Benefits module. This is where we're going to outline our eligibility. So just like in the Payroll Inspector, we were setting up the rules for our measurement, admin, and stability periods. We would do the same thing in the Benefits module. And I guess I forgot to mention at one point that this is a one or the other. There isn't a situation where we would have somebody using both tools. We're going to let you choose which type of functionality you require, whether it be the Payroll Inspector or it be the Benefits Enrollment module. Both of them are going to manage the entire aspect of the Affordable Care Act compliance and reporting, except the benefits module has a little additional steps built in as far as contacting the employee and allowing them to enroll in those benefits. So when we're setting up the eligibility, the first thing we're going to do is, again, choose, just like we did in the Payroll Inspector, which classes should be considered full-time for new hires, so we can outline that. The next thing we're going to do is set up the measurement groups. Just like we did in the Payroll Inspector, we're going to choose the name of the measurement group. If we have different or multiple measurement groups in one environment, which pay codes are applicable, and then the length of the measurement, the admin, and the stability periods. Once we have that in place, the Payroll Inspector is ready to run. The actual enrollment piece doesn't need to be set up because we're following the logic of the benefits enrollment module setup as we're going through. So when we go back over to the Employees tab, I'm going to switch environments, companies I should say. And we have an ACA dashboard. So this ACA dashboard is very neat and very comprehensive. This is going to give us an overall view of the entire environment. So across the top, these are going to be items related to the coverage and the affordability. So it's going to tell us that we have 120 employees coverage meets the Affordable Care Act qualifying offer this month. The next piece is going to be the minimum essential coverage. So again, this is that 95% of employees that we're trying to hit. This is going to give us a quick overview and let us know that we're at 80.5% of minimum essential coverage offers. The next piece is the adequate coverage. So this is going to tell us that these employees aren't being offered adequate coverage this month. So each of these tabs has a view details that's going to bring up a report for us. And this report can be filtered out at each of the column headers. So you can see over here that the current coverage offer is no coverage, minimum essential coverage, minimum value offering, and qualifying offer. We can drill in and take a look at just a group of employees based on that column header right there. So this is then going to tell us no minimum essential coverage offered. If we were to click View, it would take us into a more detailed environment to let us know how we can be in compliance with this employee. We go back to the ACA dashboard and discuss the full-time statistics. So just like in the Payroll Inspector, this is going to manage the admin, the stability, and the look-back periods. So this is going to let us know at a glance that 200 out of our 200 employees are currently considered full-time under the Affordable Care Act. So this is just telling us that every single employee that we have is a full-time employee and should be offered insurance. This is where we're going to get the updates of the employees' full-time statuses that have recently changed. So this is going to just simply tell us over the past period of time what employees have had a status change. And then the last piece in here is actually really neat. This is going to be more of a projection type item, letting us know which non-full-time employees are currently averaging more than 30 hours a week. So this will give us the ability to be proactive. And what this is basically saying is that we don't have to wait till a measurement period is over to get a calculation. So if our measurement period is January 1st to December 31st, and it's March 6th, and we have employees that are marked as non-full-time, averaging 35 hours a week, we can anticipate that this employee is going to be switched to a full-time, so you can make any scheduling adjustments that you may need to, or just to have that anticipation of this employee will be switching to a full-time status employee. If we take a look real quick, we'll be able to see the full-time statistics report. There are reports available within the Dynamics Payroll Inspector as well that would be pushed out to Excel. These are all going to be web-based reports that we can push out to Excel. So this is going to give us details on each of the employees, the length of their measurement periods, what their measurement periods are, and their full-time determination. And last but not least, we then will have this graph down here for you that's going to show you over a period of time where we're at with each of these different aspects of the Affordable Care Act. So you can see that it's telling us in February we had 200 employees, 200 of them were full-time, 120 received the qualifying offer, and 161 had the minimum essential coverage offer. So as we build up data over the year, this will be more of a flexible type report just to get an idea of where we were at any one period during the year. And then you'll also be able to choose the date range here so you can specify which period of time you want to see this report over. So the other piece that I wanted to show you was the rules-based system for including Affordable Care Act full-time status as a driver for a benefit package. So what I'm going to do is switch over here to the Settings tab once again and click on the Benefits module. And when we set up the Benefits module, the real base of this tool is the individual benefit. You're going to upload and input all of the details for each benefit. If you're using GPHR, we can simply pull that data over. If not, you can set everything up on the site, and then we'll map back to the benefit and deduction codes inside of GP. Once we have all of our individual benefits set up, the next step is to create a benefit package. And these benefit packages are going to allow us to be flexible in what we offer the employee. So when we're setting up a benefit package, it's going to show us each individual benefit that we have in this Greenshades online environment. We'll simply go through and choose which benefits we want to include. So what we're seeing a lot of our clients do at this point is set up a benefit package that may be available just to those employees that are variable hour. So we can look at employment status type inside of GP and put that as a rule, and then put the second rule as ACA full-time status. So if somebody's variable hour employee and they hit that full-time threshold, they'd be eligible for a limited benefit package, which would just include that minimum essential coverage, minimum value plan offering. Maybe you don't want to offer them 401k and voluntary life, so we can just exclude those from a benefit package. The next step is to put the new hire rules in place. These new hire rules are also going to apply to the status changes. So when somebody's added to the Dynamics GP environment and they're associated with a certain class or division, whatever one of the rules is that we put in place as an eligibility rule for a benefit package, they'll be then prompted to enroll in that benefit based on these rules under the new hire section. The next step is to then create the rules for who this is going to be available to. So if we had a very simple rule in place for a benefit package, it would look something like this. This is saying that everybody that is in the accounting department is eligible for this benefit package. If we wanted to get a little more specific, we could. We can say everybody who's in the accounting department and has a home address state of Alaska is then going to be eligible. We can then get more specific and use any of these other fields, but one of the really neat fields is the ACA full-time status. So if we had a rule that looked something like this, this would tell us that everybody in the accounting department that lives in Alaska that's ACA full-time status is going to be eligible for this benefit package. So if we had an employee that was in the accounting department, they were in Alaska, but they weren't ACA full-time status, they wouldn't have access. As soon as they had that status change from ACA part-time to ACA full-time status, the administrator of this portal would receive a notification. It would say, hey, employee XYZ just had a status change. Do you approve this status change? When you click, yes, I approve the status change, we then begin the employee notification process. So we're going to shoot portal notifications, email notifications, and even text message notifications to that employee, alerting them that they're now eligible for a benefit package. They would be then directed to the open enrollment portal that we saw over here, and they would be shown all of the benefits that are available to them, and at that point they can waive or enroll in any of those benefits. Once they do, the administrator receives notification. We push those benefit and deduction codes back into Dynamics GP to update for future payrolls, and then begin the tracking of the Affordable Care Act compliance relating to minimum essential coverage, minimum value plan, so we can include these eligible employees in the 1095-C reporting, because that's the driver for the 1095-C, is everybody who was eligible at one point during the year, whether they waived or they enrolled, needs to receive a 1095-C. So as for the benefits enrollment portal and how this can help with the Affordable Care Act compliance and reporting, I'd like to take any questions because this pretty much wraps it up for what I wanted to show today. But anybody that has any questions, be happy to address those right now. So again, just use that hand raise option and we'll see the questions come through. I'll be able to address them. So somebody had asked, will the employees be able to view the 1095-C electronically along with their W-2? The answer to that question is yes. We will be able to post the 1095-C to the portal for employees to access electronically. So if you think about the 1095-C, think about it just like a W-2. The same requirements are in place. You can post them online for electronic consent, but if an employee doesn't consent to the 1095-C electronically, then you have to issue a paper copy, which is why we do a real-time tracking of consents in January. So at some point in January, you can make the decision, okay, I've given my employees enough time. Out of the 100 employees, 90 of them got it electronically. I still need to issue some paper copies. And with the 1095 we create, it's a PDF, so it's very simple to print to blank perforated paper and hand out to your employees. So you can go that route, or you can simply elect to have Greenshades print and mail the remaining 1095-C to you. So the next question was, how much do these cost? So the Payroll Inspector is a very flat rate, very simple to price. The Payroll Inspector is $2,500 per year. That's going to manage all of the compliance for the eligibility and then also the coverage. There's another component for the reporting that will allow us to create the 1094-C in the electronic format. That tool is $1,499, but rather than being an annual fee, it renews at 25%. And if anybody on the call has our Greenshades 1099 module, there isn't additional fees. So the 1099 module is something we've been offering since late 90s, and we basically just updated it a couple months ago to include the 1094-C reporting. So if you currently own that, you have the functionality already available to create those e-files. So if you don't own the 1099 module, the first year cost for the Payroll Inspector and reporting tool is $3,999. It'll renew annually at right around $2,900. The benefits module is a little more difficult to price without knowing more about a specific situation because it is driven off of the number of employees. So it's a tiered pricing structure. And if any of you are currently using our employee services portal, this would simply be an add-on to that earning statement, the electronic earning statement, electronic W-2s that you currently do with us. So it is an additional module in the employee services portal. I would be happy to go over the pricing, but we can talk about that when we have more information. So if anybody wants pricing on the benefits module, just let Carolyn or your contact over at DFC know, and we can then work on getting you the pricing for the benefits enrollment module. So anybody else have any questions? We can talk about the Affordable Care Act compliance regulations, any of the tools that we went over, whatever it may be.
Hey, John, a question that sometimes comes up for some customers is they're concerned about upgrades. So how does this affect the GP upgrade, or how quickly are you ready for GP upgrades once that's released, that type of thing?
So we have access to the new versions of GP before the general public does because we create software that interacts directly with it. So we've been working on the 2015 since the beginning of 2014. So if there's an upgrade made to Dynamics GP, the upgrade will automatically be pushed out to all of our solutions to make sure that they're interacting properly, and those updates go out as simple over-the-air updates. You would open the Payroll Inspector and it would say, hey, we have 5 new updates for you to install. Do you wish to install them? And you would click yes. And those updates would be pushed out as well if a regulation changed. Maybe there's a new regulation next year where 30 hour, instead of offering employees coverage at 30 hours, it's 32. That's not going to happen. That's completely made up. But if that were to happen, we would push out an Affordable Care Act compliance update as well. So I have a couple other questions over here on my end. Somebody asked, we have the Greenshades Center and use it for electronic reporting of W-2s and 1099s. Just want to confirm that the electronic 1095-C reporting will be added at no other cost. We do not use the online center. So the 1094-C is the form that goes to the IRS. We're going to build that in the electronic format out of the 1099 module. The 1095-C is the form that goes to the employee. So to use our solution for electronic distribution of 1095-Cs, there's going to be a small cost per form. So there's not going to be another lump sum that you would need to pay us in order to have functionality to build the 1095-C, which again is the form that goes to the employee. This year, the cost for our year-end forms, which include W-2s, 1099s, 1098s, and next year includes the 1095-C, is going to be 31 cents per form. So you would be charged 31 cents to upload the electronic version of the 1095. Included in that 31 cents, we'll post it to the portal. We'll host it all the way through December 31st so your employees have access to download permanent copies or print out permanent copies. Same from the administrator side. You'll have access to that form on the portal through December 31st, but you'll be able to download the PDFs as permanent copies so you'll have a permanent record. And if every single employee elects to have their 1095-C distributed through the portal electronically, there's no other cost associated with it. If you have employees that haven't gotten their their 1095-C on the portal, there'll be some small additional costs for the completion of the distribution. So you'll either have a paper cost because we create an electronic file that you can print to blank perforated paper and pass out to your employees, or there'll be some small additional cost per form for the mailing of those 1095-Cs if you use the Greenshades option for that. So another question was, can information be tracked between companies if an employee works for more than one of our companies? So we are currently doing some work for the aggregated reporting. So at this time, the Payroll Inspector is looking at a per database, per company situation. So if we have one employee working for 2 companies and you need to combine their hours, if you installed the Payroll Inspector and ran it today, it wouldn't combine them. We have the update that should be going out sometime mid-April that will allow us to do some combining to make sure that we don't need to do any manual work after the calculations were completed. So at this point, there is a small manual process that would need to take place for us to combine those hours for reporting, but it's a pretty simple manual process. But we'll be pushing out an update here relatively soon that would allow us to do that automatically. All right, so that clears out my question box unless anybody has anything else. We've still got 8 minutes here, so any other questions would be happy to address. At this point, though, unless another question comes in, I'll pass it back to Carolyn. I really appreciate everybody taking the time today to go through this. I hope that it was helpful for everybody and you learned something. And if you have any follow-up, please feel free to contact your DFC rep, and they'll get in contact with me for any additional information that's needed. So again, thanks everybody for having me present today.
Thank you, John. We really appreciate it. I know there's 5 of us sitting in here at DFC, and we learned a lot more today and see quite a bit of automation that's available in your solution, so that's looking really good too. Jody and I will be reaching out to you guys to see if you have any follow-up questions, if you're wanting to proceed with any purchases, have any additional questions, that type of thing. And then like John mentioned, we can always get him back on the phone and help us run through some things that might be specific to your company scenarios. So with that, we want to thank you again for attending, and we will be in touch with you. You guys have a great weekend.